Hi, in today's video we will focus on high-yield USMLE questions related to the respiratory system. A 4-year-old boy is brought to the emergency department with sudden onset of high fever, difficulty breathing, and refusal to eat. His parents report he is behind on vaccinations. On examination, he is sitting upright with his neck extended, drooling, and has inspiratory stridor with subcostal retractions. Vitals are temperature of 40.2 degrees Celsius, heart rate of 128 beats per minute, respiratory rate of 34 breaths per minute, blood pressure of 98/60, and oxygen saturation of 93% on room air. What is the most appropriate initial next step in management? In order to choose the correct answer, we must first identify the underlying condition. This child's clinical presentation, which includes sudden high fever, inspiratory stridor, drooling, refusal to eat, and subcostal retractions, is classic for acute epiglottitis, which is a rapidly progressive and life-threatening upper airway infection causing inflammation of the epiglottis and surrounding supraglottic structures. The most common cause of epiglottitis is Haemophilus influenza type B. However, the incidence of infection with this pathogen has decreased substantially in the past decades because of the Haemophilus influenza type B vaccine. Since this child in the question is not fully vaccinated, he is at the significant increased risk of infection with Haemophilus influenza type B. The options given here are A. Rigid bronchoscopy, B. Salbutamol treatment and monitor response, C. Corticosteroid treatment, D. Broad-spectrum IV antibiotics, E. Prepare to intubate. The correct option here would be E, and that is because the primary concern in epiglottitis is sudden airway closure due to inflammation and edema of the supraglottic structures, particularly the epiglottis and the aryepiglottic folds. The airway can rapidly progress from partial obstruction to complete obstruction within minutes, especially if the child becomes agitated or is handled improperly. Therefore, the most appropriate and urgent step in management is to secure the airway immediately, and this is done by controlled intubation in an operating room or intensive care setting, ideally by an experienced anesthesiologist or otolaryngologist, and we can use humidified oxygens en route. It can be helpful but should only be given if it does not agitate the patient, as crying or struggling increases oxygen demand and worsens airway edema. And we should not delay intubation in favor of other treatments, as this can be fatal. Let's have a look at why the other options are incorrect. Option A is incorrect because rigid bronchoscopy is indicated for suspected foreign body aspiration presenting with sudden cough, wheezing, or asymmetric breath sounds. And attempting bronchoscopy without airway control is hazardous, as it may cause complete airway closure during sedation or instrumentation. Option B is incorrect because salbutamol is a beta-2 agonist used for bronchospasm in asthma or COPD. It relaxes bronchial smooth muscle and not inflamed supraglottic tissues as seen in epiglottitis. This patient in this question has airway inflammation and not bronchospasm, and salbutamol would not help and would in fact cause worsening of tachycardia. Also, delaying airway protection for salbutamol may result in catastrophic airway obstruction. And option C is incorrect because corticosteroids are used to reduce inflammation in croup. However, corticosteroid use is not universally recommended as an initial treatment for epiglottitis because lack of evidence of it to be helpful in acute epiglottitis, and this might also delay urgent airway management. And option D is incorrect because while antibiotics like ceftriaxone or cefotaxime are essential for treatment, they are not the immediate priority. Airway obstruction must first be addressed with intubation, and attempting vascular access can increase agitation and risk airway collapse. After securing the airway, antibiotics can then be started. A 35-year-old man presents to his primary care physician with sudden onset of fever, chills, fatigue, muscle aches, nasal congestion, sore throat, and dry cough that began earlier in the day. He mentions that several of his co-workers have had similar symptoms recently. He has no significant past medical history and takes no regular medications. His temperature is 38.7 degrees Celsius, heart rate is 92 beats per minute, blood pressure is 125/76, and respiratory rate is 12 breaths per minute. Physical examination shows mild throat erythema but is otherwise unremarkable. A rapid influenza test is positive for influenza B. Which of the following antiviral agents is appropriate for treating this patient's condition? Now, this is a straightforward question. The diagnosis of influenza B is already given. To answer this question correctly, you simply need to understand the mechanism of action of different antiviral medications. The options given here are A. Acyclovir, B. Ganciclovir, C. Lamivudine, D. Oseltamivir, E. Ribavirin. The correct option here would be D. Oseltamivir inhibits the influenza virus neuraminidase enzyme, which is essential for the release of new viral particles from infected host cells. By blocking neuraminidase, it prevents the virus from spreading within the respiratory tract. This helps shorten the duration of illness and reduce symptoms severity when started within 48 hours of symptom onset. Let's have a look at why the other options are incorrect. Option A is incorrect because acyclovir is a guanine nucleoside analog used to treat DNA virus infections. It is activated by viral thymidine kinase, and once activated, it inhibits the viral DNA polymerase, blocking DNA synthesis. It is effective against herpes simplex virus and varicella zoster viruses, all of which are DNA viruses. It is not effective against influenza B virus because influenza B virus is an RNA virus and does not rely on DNA polymerase or thymidine kinase. And option B is incorrect because ganciclovir is a guanine nucleoside analog that requires phosphorylation to be effective. It inhibits viral DNA polymerase, causing DNA chain termination. It is used in the treatment of cytomegalovirus, which has a viral encoded protein kinase that activates the drug. And option C is incorrect because lamivudine is a cytosine nucleoside analog. It inhibits reverse transcriptase, an enzyme which is required for retroviral replication and is used in treatment of HIV and hepatitis B virus infections. Lamivudine targets reverse transcriptase, which is not present in influenza virus. Hence, it is ineffective in the cases of influenza. And option E, ribavirin, is incorrect because ribavirin is a guanosine analog that interferes with viral RNA synthesis. It inhibits inosine monophosphate dehydrogenase, reducing guanine nucleotides, and promotes lethal mutagenesis of viral RNA. It is used in treatment of RSV infections, and although ribavirin targets RNA viruses, it is not approved or recommended for influenza B treatment.